Neha, working as a speech language pathologist in Pinnacle Blooms Network.
This is Ketan from Suchitra 2, a behavior therapist.
Today the webinar topic is on Ankyloglossia. So what is Ankyloglossia? Ankyloglossia is nothing but generally we tell it as tongue tie. The normal term which basically people use is tongue tie. So what is tongue tie? It is the restriction, it is a short thick band, tight band of tissue that is present at the bottom of the tongue, at the bottom of the tongue, which is normally a lingual frenulum. Okay, what happens is, why we call it as a tongue tie is, tongue tie is usually present at the birth. It is normally present at the birth, which restricts the range of motion of the tongue. The motion, that is the movement of the tongue.
And then speech is
maybe affected. Maybe affected in that. Yeah. So what is that? Why do we have that? Is the lingual frenulum, which is, that separates at the birth in some, but it doesn't separate in some people. That is the reason they'll be having a tongue tie.
Yes.
Okay. There are different types of Ankyloglossia, that is different types of tongue tie. They are classified into 4 classes. Okay.
4 grades.
4 grades or classes, we can tell it. Yes. The first class is the mild Ankyloglossia. So what is mild Ankyloglossia? As earlier I told you, that is the lingual frenulum which attaches the tongue and the mouth.
Yes.
So it is, the lingual frenulum is 12 to 16 millimeter. For the first mild Ankyloglossia. So it is thin and elastic, where it is the tip, that is the sharp point, the front
is
tip of the tongue is attached to the mouth.
Yes, you can see this
the
one
lingual,
tissue.
The tissue,
the lower mouth and the tip of your tongue is connected with one tissue, and that tissue is found some problematic or it having issues with
this mouth. Then it is called as the Ankyloglossia.
Yes.
So the second is the moderate Ankyloglossia. The second class we call this moderate Ankyloglossia. It is 8 to 11 millimeter. So where the lingual frenulum, it is fine, very thin and very fine, and it is attached at the little bit of tongue, not the tip, near the tip, little bit back of the tongue, to the mouth. Okay, that is moderate. Where we go for the third class, that is severe, where you see the tip of the, not the tip, the base of the tongue is attached to the mouth. Okay.
Can we show pictures to our viewers?
Yeah, you can see this is the tongue, where this is the tongue. Okay, where you can see this is the frenulum. This you call it as a lingual frenulum, where this is your tip. And in the class 3, as I've told, it is severe Ankyloglossia. This is the base. So this is the base, the lower part of the tongue. This is the base, is attached to the bottom of the mouth.
You can see near the gums. Even I think if you watch in the mirror, you can
clearly
spot that specific tissue.
And in the fourth, as I've told, the fourth is complete Ankyloglossia. We call it as complete. It is less than 3 millimeter, and the front side of the tongue. The front side of the tongue, as I'll show you. This is the tongue. This is the tongue. The front side of the tongue is elevated, like it is moved.
Yes.
And the middle part is attached to the mouth.
Because the tissue length is, I think,
very small.
Yes.
And the tongue, you can see, it is like a heart shape.
Heart shape. Yes. It is stretched out towards your lower mouth.
Okay. These are the 4 classifications of Ankyloglossia. So what is the main cause? Primary cause of Ankyloglossia is during the birth, before the birth, the lingual frenulum, actually it should be separated from the tongue to the mouth.
Lower mouth, yes.
But in some babies, it won't get separated. That is the reason we have a tongue tie. That is Ankyloglossia. Will be seen. Okay.
Yes. Maybe the development of that part of the mouth is not done properly.
Yeah, that is the reason they'll have a tongue tie.
Tongue tie, yes.
So, what are the early signs? How you can know that the baby is having a tongue tie or the child is having a tongue tie?
Yes, I think this is very important because you should know what is normal and when you have to seek a doctor or when you have to seek a specialist.
Yeah.
Yeah.
So, what is the early sign is? The kid may have a difficulty in lifting their tongue up.
Yeah.
Might be up.
Yes. Even I think viewers can, anybody can check when they are playing with children.
Yeah, you can check it like playing in a normal way, funny way. You can ask the kid like, pull your tongue out, put your tongue out.
Yeah.
They may be doing it. So if the second is if the kid is having difficulty in moving the tongue sideways. Might be sideways.
Yes.
And if the kid is having difficulty in putting their tongue out, completely out, and as I've told earlier, when the kid is putting their tongue out, you can see a heart shape
lower part in the lower part of the tongue, because as we
not
saw,
the lower part. Actually, the tongue. Normally, the tongue when they put it out, it will be in a heart shape.
Okay, because this part is stretched out, as ma'am said. Yeah.
Because they get elevated. That is the reason. And the other sign may be when they kid. Normally, we can check the kid is having an Ankyloglossia during when the baby is in the months also. Like if the kid is having a problem during breastfeeding, like the baby is not able to take the milk, like has difficulty in latching the milk. So during breastfeeding also, if the kid is having a fluffiness in their mouth, and if the session, like breastfeeding session is very long, if they have a very long session also, you may feel it that the kid may have a Ankyloglossia. So if the kid is also is underweight, because the kid is not able to take milk. Proper diet is not able to be followed because the kid is not having proper food. There may be underweight also. This may be also sign of the Ankyloglossia. So difficulty in, they may make different sounds like clicking sounds while having a breastfeeding. This kind of sound. And difficulty in speaking might be because of sound errors like t, d, l. Sounds will be difficult for them while speaking. Their clarity will be missing in there.
I want to ask one thing, ma'am. We described some grades of Ankyloglossia.
Yes.
So would there be any difference in speech ability of the child?
Yeah, it may be
according
difference.
To the grade.
Yes. Because of the movement, as I've told you, they'll not be able to touch their palate.
Okay.
So some errors will be there. Like they may have a misarticulation. Articulation problem will be there. Sounds like, as I've told now, t, d, because they have to touch the palate. They'll be having a problem. So instead of d, they may be saying as th, because the tongue touches to the teeth only. That is, they may have difficulty in speaking.
Yeah, even those can be said as signs. You see a specialist.
Yeah, you can seek us other like speech pathologist. Difficulty in swallowing also, because swallowing, they have to swallow. They have to put their tongue back. They have to swallow. They may be having a problem. Difficulty in licking an ice cream also, because they have to put their tongue out and lick an ice cream. So they may be having a difficulty in licking an ice cream or any other kind of foods which they lick. Difficulty in touching their back teeth with their tongue. Teeth back
teeth.
Difficulty playing any wind instruments, like any kind of instruments that has air to blow. Like it may be a whistle, any flute.
Yes.
So they have to put their tongue back.
Yeah.
That is the reason they may have a difficulty in blowing a wind instrument. Trouble in kissing also may be a problem because they have to protrude and the tongue has to move back.
Yeah.
That is also may be a sign of tongue tie. That is ankyloglossia.
All this activity, tongue is in the action, so you can know where the tongue is acting or not, or whether your child is doing that or not.
So if they have any kind of these problems, there is a treatment solution where you can contact Pinnacle Blooms Network.
Yes, we have the light. Yeah.
So what is the treatment to be done for the ankyloglossia? So there are some surgical things to be, surgical treatment is done where it is called, where if the child is facing any problem due to tongue tie, that is frenotomy and frenuloplasty. There are two surgeries done. So frenotomy, it is done without anesthesia. We can do it without anesthesia. And complications are very rare in that. If they have any complications, it may be only bleeding, any kind of infections or damage to the tongue or salivary glands, the salivary glands which you have. Coming to the frenoplasty, that is the frenoplasty, it is an extensive procedure. So where the lingual frenulum may be thick, very thick. Because of the thickness, they may be not be able to do frenotomy. That is the reason they'll do frenoplasty. And it is done under general anesthesia. You have to have an anesthesia to be done. So complications are same as frenotomy, like they may have a bleeding, as I've told, infections, damage to the tongue, to the salivary glands. So these are the treatments. So if they are untreated, what happens if they are untreated? When the baby is growing a little high, like when the kid is going into a young child, they may experience health consequences like they may be unable to chew their food properly. Choking may be present. Gag reflexes may be seen. And vomiting of food also may be done. Because they are not able to eat properly their food.
Yeah, the mastication process is not proper.
That is the reason they have vomiting sensation and they'll vomit the food. So if tongue tie is very challenging to this to speech, as I've told, it is the placements, the articulation errors will be there. So it will be very difficult for them to produce those sounds. So they may be feel little guilty, like why I am not able, because of their clarity. Some people will think that they're laughing at my speech. My speech is not clear. They may grow some other different kind of behaviors.
Issues like they might have lack of confidence and
they may feel shy.
Socialization is not improved. They might have social anxieties, anxiety issues, performance anxiety.
They may be very weak. Like they may think themselves as very low because of that. So the sounds which doesn't have mobility are t, d, z, sh, th, r and l. These sounds they may have a problem when they have a tongue tie. So if you see their severity, if the severity is more, as I've told the 4 classes. The severity is more, they may have a problem. Like they may palate maybe. If it is very completely ankyloglossia, they may not be able to touch their palate.
Yes.
So bad habits, like as I've told you, like they may be having anxiety, fear. So these issues, behavior issues may increase.
These are the issues or these are the conditions which you generally see in your child. Yeah. So there is always a chance that to see that why this child or why my child is not speaking up, why my child is feeling shy. So everything is the background or the base of everything is this a small
frenulum.
Yeah, and he's not able to speak, and this everything can it can go on a
beyond very drastic
change. Yes.
So some children who have tongue tie may have speech. Their speech will be normal, but they'll have a misarticulation. But if they doesn't have any speech issues, if they have speech issues, but you have to know that when a kid is around a year, usually they make simpler sounds like p, b, m, n, t, s. So you can see t sound should be achieved within a year. The kid is not able to say the sound t. The kid is not able to say the sound sh. Sure. So you may think that the kid is having a problem. So instead of thinking my kid is not able to say, why the kid is not able to say the sound?
That tongue time might be the reason.
You have to seek a doctor. You have to seek a specialist.
Yes.
So you will come to a solution like, this is the problem where you can have a solution for it.
Do we have therapeutic solution to this problem?
Yeah, not a complete therapeutic solution, but I can tell you like they'll be having some tongue exercises to move their mobility of their tongue. So I'll explain detail later.
Sure.
So now as I've told you, like they may have a limited range of motion. Tongue movements are very low. So some sounds will be affected.
Yes.
Even l sound, th sound also can be affected when it is complete ankyloglossia because it is not able to move.
Generally, these sounds we have to make the very vast tongue movement.
Yeah.
And there we get that the sound is not coming. Then you have to see that maybe that tissue or the tongue is not functioning
properly.
Yeah.
So as I've told that I'll be discussing few exercises what to be done when a kid is having a tongue tie. The symptoms that without surgery also they can reduce, but not clearly, not completely. It won't reduce the tongue tie.
We can reduce it, but we have to take some surgical or specialist.
Yeah. So the tongue movements, and they can improve their control over their tongue and also correct their maladaptive use of their tongue.
Yes.
And their mouth.
Yes. Okay? Even this is improvable?
Yeah, this is improvable. Like the placement, articulation errors may be there. So after the surgery, many researchers have found that due to this after surgery, the words, like if they have problem in articulation, like as I've told, sounds in d, t, th. So these sounds may be corrected through speech therapy because they'll be showing the placement and all after the surgery.
After the surgery.
So they'll be showing the placement. Some addition, distortion, substitutions of words will be there. So these all can be cleared after the surgery through speech therapy.
The speech therapy is must after the surgery.
Yeah. No, it is because the placement is not clear, because the clarity is not good. They may be having some this thing, as I've told, like addition of words, subtraction of words, subtraction of some syllables. They may distort, like the word which they produce is not clear. We may not know that the word which the kid is telling is different. Like we may ask the kid like, what are you telling? So it may be different, and some kind of this addition distortion may be reduced through speech therapy after the surgery. So the exercises which we have here is like we ask the kid or the child to stretch their tongue up and down. This movement. Like simultaneously, frequently we ask them to do like that. And the second exercise may be open the mouth wide and touch the mouth and touch the front teeth.
The front teeth has to be touched from the back by the help of this tongue teeth. Yeah.
And the next exercise is lick the whole lip, that is the lip.
Yeah. So,
clockwise and anti-clockwise. This is the action.
The rotation of the lip has to be
upper lip. And the vice versa. It should be done from right to left and left to right. The other maybe vice versa, the down part. We ask them to rotate, ask them to lick the lip. And the next one is stretch the tongue out, like completely out. How much they can put their strength to put their tongue out.
Yeah.
Completely out. And the other exercise is poke the tongue to the left cheek to make a lump. You can feel like this.
Okay.
Moving the tongue to the cheek to make a lump.
Lump, yes.
So this is called
this
a lump.
Has to be there.
Yeah.
So the tongue is getting exercised.
Yeah, the tongue movements may be exercised. And the same thing towards the right side.
Right side, yeah. This left and right both.
Yeah. And the next exercise we make the kid to do is move their tongue in and out with the mouth open.
Yeah.
This is the exercises we normally do.
Yes.
Ask the kid or the child when they have a tongue tie. So, as I've told earlier, like we know that speech therapists are here. Though they have articulation, normally when they have articulation problem also, when they have a tongue tie, articulation problem arises there also. But the thing is that when a kid is having a tongue tie and he's having articulation problem, after the surgery like frenotomy and frenoplasty, so their articulation errors may completely come down easily compared to an articulation disorder. Like they'll completely have a very good grasping, so their tongue movements will be very frequent. As I've told, tongue tie has restrictions in their tongue. But after the surgery, that is the frenoplasty or the frenotomy, so that restriction goes away. So they'll be having very frequent movements of their tongue. So those movements has to be directed by the speech therapist. Yes. So they'll be easily able to move forward by moving their tongue. So articulation problem and the problem with the tongue tie, though they have articulation errors, we can say that articulation errors come down when they have a tongue tie easily when compared to the normal articulation disorder. Yeah. So if you have any queries, you can ask. Yeah.
Now the session is open for the queries and questions.
I think we don't have any questions. Yeah. So the session is complete and thank you.
Thank you.